My name is Jesse, and I am here to discuss the setup and procedure of a composite resin restoration that a dentist and dental assistant will perform on a patient. To begin with, a composite resin restoration is a tooth-colored filling that is different in comparison to that of the amalgam or the silver restoration, as not only are they made of different materials, but they are used for different purposes. All in all, it is up to the doctor to decide what is the best material to use for a patient. Most of the time, though, in a civilian setting, the doctor will go with a composite resin restoration, as the composite is actually tooth colored and is more aesthetically pleasing to the patient versus the silver. So, after that has been decided, the patient will then make their appointment to come in. The dental assistant then has to set up the room in order to make sure that we are able to do the procedure. To begin with, the dental assistant will grab what is called numbing jelly, and this is our topical jelly there. We also grab a syringe, some needles, some numbing agents. These will typically include lidocaine, Septocaine, or Marcaine, depending on what the doctor wants. Most doctors do not use Novocaine, as it's actually less effective than the newer anesthetics that we now have. The dental assistant will then also grab what is called a basic setup. This consists of a mirror and an explorer. It's also the tool that the doctor uses just to check teeth in order to make sure that there is decay within that tooth. After that, the assistant will also grab what is called a composite setup. This is going to include a ball burnisher or an acorn burnisher, up to the doctor there as well. They're also going to grab what is called a plastic instrument, and that is also known as a flat. It's just exactly what it sounds like. There is a flat-ended instrument on both sides, and that's what doctor is going to use to make sure that everything is packed nicely within the tooth. After that is all done, the dental assistant will also grab what is called a curing light. This is just to help cure our materials that we're going to be using there, and an articulating paper holder. The articulating paper holder is how we determine that the bite of the patient has maintained the same after we've put this composite resin restoration in. After that is done, the dental assistant will grab the patient back and place them in the chair, and then go over health history and blood pressure with the patient. The doctor then decides if their blood pressure is too high, if we do need to reschedule that appointment. However, very likely the patient will be fine. So, if the blood pressure is good to go, there's no new health history or allergies that we need to be aware of, or medications that could interfere with the numbing there, the doctor will go ahead and numb the patient. We use our numbing jelly first. This just numbs the tissues of the patient in order to make sure that they at least don't feel as much of a pinch when the doctor places the needle. After that is done, we let the patient sit for a couple minutes there just to make sure that they're nice and numb. Then the doctor will begin prepping the tooth for the filling. In order to do this, the doctor will use what is called a high-speed or a slow-speed handpiece. The slow-speed handpiece does not cut tooth structure versus the high-speed that does. And the reason that there are two differences here is a lot of times what doctors will do is they will get into the tooth and begin to cut out a lot of the tooth structure. We want to maintain as much of it as we can. So doctor will try to get as much of the decayed tooth structure out as possible, but also just make sure that it's nice and even on the areas so that the filling is less likely to come out after the procedure is done. Then after that, the doctor will use the slow speed just to make sure that we have all the decay out. Once that is all finished, then the doctor can actually begin the process of placing the composite filling. We start with phosphoric acid, which is also known as our etchant. What this does is it essentially will roughen up the tooth structure inside where we have prepped, and this is just to make sure that the bonding resin and the actual composite resin will adhere to the teeth. Once that has been placed, the etchant, the doctor and the assistant will rinse the tooth out, dry it. Doctor will then place the bonding material there, and after that is done, the assistant will then cure the tooth with that curing light that I talked about earlier, and then what we'll be able to do is actually put the packable or the flowable composite in. Doctor will use either one or both of those. Typically, though, the doctor will go with a packable. Now, this packable is typically more sturdy than the flowable material is. However, both are very effective in keeping decay out of the teeth there. So once the packable is placed, the doctor will then use the instruments that I talked about earlier, like the ball burnisher, acorn burnisher, or the plastic, in order to make sure that there are no voids and that there as much tooth anatomy as they can put in there, just so then you can always take off this material versus putting more on. After that is all finished, the assistant will then cure again at that curing light, and then what we'll do is the doctor will polish and ensure that the patient can actually bite on this tooth properly. If the patient has too much biting pressure, there is a chance that they will need a root canal in the future. But other than that, the patient is then able to leave the room and be done with their procedure. So that is how a dentist does a composite resin restoration.